As kids get back to school, they'll need more than new supplies. Many students will be getting a round of required vaccines, and August is Immunization Awareness Month, a time to make sure that we're all up to date on our shots. So here to talk more about this is Dr. Reggie Washington, the Chief Medical Officer from Presbyterian St. Luke's and Rocky Mountain Hospital for Children. So first of all, thanks so much for taking the time to talk with us.
Pleasure to be with you.
Absolutely, we appreciate it. I guess to start, what are some of the required shots that students need before heading to school?
Well, there's quite an extensive schedule of immunizations depending on the age of the individual and their previous experience with immunizations. But they're to protect against things that a lot of parents may not have any experience with: measles, mumps, whooping cough, and now polio. Those are the common ones that immunizations truly have made an impact on getting rid of these diagnoses. And that's why parents may not have heard of them or experienced any of them.
Absolutely. And I guess since the end of last school year, the COVID vaccine approved for children under the age of 5. What do you want parents to know about that shot?
Well, unfortunately, from a perspective of how many patients are actually in that age group getting the COVID vaccine, the numbers are very small. They're in the teens. And that means that the majority of children in that age group who are eligible to receive that COVID vaccine haven't taken advantage of that. That's going to become a potential problem when school starts because, as you know, the CDC has changed the recommendations for exposures, et cetera, with COVID. And when those kids come back to school, they may be a reservoir for spreading COVID throughout the community.
Right, which is important to think about, and I'm sure they'll keep that in mind heading back to the classroom. Let's talk about adults, too. So many adults, they kind of lose track of their vaccines. What shots do you recommend in adults?
They should certainly keep their tetanus up to date, and if they haven't had a polio vaccine or don't know that they've had a polio vaccine, they really need to get that as well. And the importance of that is becoming very obvious back east, where they now have a case of polio, but now they're testing the water in New York City and finding that polio is in their water as well, or in their sewer. That means that there are vulnerable populations in New York who can get polio. And remember, polio was non-existent prior to that time due to vaccinations and immunizations.
And if you have lost track or don't know if you've gotten that vaccine, is it pretty simple just to go to the doctor to get that checked, or how should people do that?
Yes, if you're not sure your immunization status, go to your healthcare provider, and they can either find your records or they can start a new series of immunizations. There's actually a schedule for people who do not know their immunization status on when to get those immunizations and how they should be spaced out and so on. So there's no guesswork. If you don't know your status, let your healthcare provider know, and they can get you up to date.
That's great information. Is there anything else that you want our viewers to know that we haven't talked about?
Yeah, I think people are complacent, and particularly during COVID, the percentage of children, at least, who've been immunized went down. And that's a particular problem in our state because our state has lagged behind the national average before COVID, and now that difference is even increased. So Coloradoans have an opportunity to really bring this up to date and get their children immunized.
Yeah, that's important. I know a lot of people didn't make their way to the doctor during COVID, so got to keep up with that and get back up to where you should be.
Absolutely.
Well, great. Thank you so much, Dr. Washington. We really appreciate it.
Thank you. Appreciate it, and you have a good day.
You too. We'll be right back.